Welcome to the Dogtor Bros, where we have an honest discussion around vet life in and out of the clinic. My name is Jeff. I'm your doc of the day and your guide through this episode. I'm a dermatology associate veterinarian living in Louisville, Kentucky, and I'm here with my closest friends from vet school.
Hey, this is Chris. I'm a GP in North Carolina.
Hey, this is Brandon. I'm an internal medicine associate veterinarian in Colorado.
And this is Adam. I'm a relief veterinarian in Louisville, Kentucky.
And this is Jeff again. So we're going to get into a little bit about vaccines, which we surprisingly have not covered. So this will be more of an in the clinic episode. And we'll start off, as always, with a fun question. I'm going to be so nice to y'all. I was going to do so much more than this, but I'll just give you a very easy question. What is your favorite dermatologic condition to treat?
This is Adam. I think I'm going to go with Demodex because it's so easy. You know, they look terrible. You put them on a Bravecto and voila, treat maybe a secondary infection here or there. And all of a sudden they're a brand new pup. So clients love to see it. It's a quick fix. It's not a long-term management like a lot of things in the dermatology world. Mm-hmm. So yeah, I'm going to go with Demodex.
Hey, good answer. Good answer.
Yeah. Adam stole my answer. This is Brandon. I was going to say the same thing for all the same reasons. Because I like chronic conditions, just not derm chronic conditions.
Touche. Chris?
So I'm going to be boring. Dyson had Demodex and I had to treat it the old way. And so now I'm jealous. And so now the easy way to do it is just doing it with Bravecto or anything else. So yeah, I like that one because it's easy.
Like the old way, like you gave them Amatraz dips?
Yeah, I had to dip them. Like we had to do baths for like every 3 times a week, I think is what it was. For like,
oh god,
on and off. Yeah, it was terrible. We did it in the winter too, so we had to do baths outside. And so he hated that.
Oh,
but
jeez.
Yeah, he had baths at one point. Like it was like 3 months we were doing baths. Like it was terrible.
Oh my god. So for those listening who are not familiar with Amatraz dips, basically it is a very smelly and potentially dangerous to humans type of dip. Like it can cause neurologic issues, and if you happen to be diabetic, like it's not advised, as it can cause hyperglycemia and a lot of other issues. And so it's highly recommended to do it in an open air environment. And I honestly just say if you completely avoid it. I don't recommend them, but it's technically I believe it is still the only licensed way to treat Demodex, which is actually mind-blowing to me because isoxazolines work great and there's good research on it. So
all these young vets don't know how good they have it.
I'm saying
modern medicine.
Boomer vets over here, like we
young whippersnappers.
Back in my day.
Oh god. So we're going to swing into some questions about how we use vaccines in the clinic. And I was just going to start off by asking you guys general question, and anybody can answer, but how important are vaccines and how would you describe them, let's say, to a client who is extremely skeptical about vaccines? This
is Brandon. I'm not giving a lot of vaccines anymore now that I'm not in GP practice, but I think they're extremely important. If there's anyone with hesitancy, first off, I look for the tinfoil hat. If that's not there, then I ask them, what are their concerns with vaccines? Because you just ask owners, like they'll be honest with you as long as you're being genuine and talk to them. And most folks try and do their own research nowadays, which is a tricky thing because there's a lot of misinformation out there. I think the majority of folks, when we're talking about, if there's any concerns about vaccines and why, oftentimes it's about reactions, and we can talk about that in more detail later. But aside from all of those concerns that owners might have, and I'm sure we'll talk about this in detail, like I think vaccines are key to minimizing highly infectious diseases that can spread across a population relatively quickly. And the whole point is to decrease the amount of the population that can be potentially infected, and then thus decrease the spread. So I think they're highly important. And I know we're going to get into individual vaccines and diseases, but I'm sure everyone here has either like directly managed a parvo puppy or has known someone that's managed a parvo puppy. And, when you learn that, all it takes is appropriate vaccination and caution when they're young to prevent such a devastating disease, your perspective is changed if you were kind of skeptical before. So those are my things, like just seeing some of these patients become really, really sick from highly infectious diseases that are preventable by just getting a vaccine. I think they're very, very important.
Yeah. And this is Jeff, Brandon. I really like one thing or two things you pointed out was, number one, there's a lot of misinformation about vaccines. So if you can, consider getting your information from a university-based website, something with an edu behind it, or potentially a government organization should also have good information. The AVMA website, that's our American Veterinary Medical Association, things like that are really good resources. And also veterinary clinic websites often have useful information too.
Yeah, this is Adam. I'm glad you highlight that, Jeff, because I was going to do the same thing that, a lot of clients are doing their own research now, which in a sense is a good thing, but can be a little scary just because of all of the misinformation out there. But as long as they're open to, researching those credible websites, there's a lot of really good information out there to be had and to learn about this sort of thing. Obviously, I'm all for vaccines. They're very important to help control diseases, very common diseases that we see within the field. In terms of communicating the importance of them and really what they are to clients, one way that I try to kind of help inform them is to kind of point out that the goal of a vaccine is to just strengthen the body to use its own defense against these diseases. Like the whole point of a vaccine is to elicit a immune response, which is the body's natural defense against these vaccines. So, it is, in a sense, a very natural defense because that's what we're trying to elicit with these. Again, and like Brandon said, we all see those parvo cases and really sick cases that could be avoided. And, I kind of let people know too, because sometimes I'll see dogs that are vaccinated for Bordetella or parainfluenza, and they end up with an upper respiratory infection, which I know is kind of a bad example because there's a lot of different organisms that can cause upper respiratory infections. But, and you'll get the question of, well, they got their Bordetella vaccine, why are they having this issue? And it's like, well, vaccines aren't 100%. They're not going to guarantee that your pet's not going to get it. But a lot of times, if they get it, they're a lot less likely to get it. And a lot of times, if they do get it, the clinical signs that we see associated with that are a lot less severe. So I've seen dogs come in with upper respiratory infections that aren't vaccinated, and they're really sick, and they have fevers, and they're not eating, and they're lethargic, and this, that, and the other. And then I've seen dogs come in with upper respiratory infections that are vaccinated, and they have a cough, but otherwise they're totally normal. So, again, there's a lot of benefits to vaccines. It's just trying to stimulate that immune response and help to decrease the possibility of contracting that. But even if you do, lessen those clinical signs we see associated with that disease.
Yeah, I 100% agree. And I really like how, Adam, how you pointed out that you can still get sick when you get vaccines, just like every year when people like update their flu, because the vaccine, as you described it, I would say, or how I sometimes mention it to clients, is that it does not mean you will not get sick, but it basically gives your body a bunch of little warriors to prepare. So when the body is exposed to something, they'll be able to fight it off better. So it's not a 100% zero illness state that we're inducing, but we're getting the body ready to, like a puppy experiencing parvo. And how I learned, because unfortunately I had to read a veterinary immunology book very recently, which I'm really sad about, but it did teach me something that I think I had forgotten from vet school, which was when the mother basically transfers over antibodies, those only last for a short period of time in like a puppy or kitten's life, in a new animal's life, humans too. So those vaccines are trying to get ahead of the curve so there's not a lag period where you could get really sick and experience parvo and distemper. And that's something that's pretty easy to tell clients too. Obviously, I'm speaking from past experience, and I'll get into how vaccines enter my life now in derm land. But that'll kind of lead into my next question. I'd like to hear from y'all first before I blab on. But how do each of you, if you could briefly tell me, how do you see your classic vaccine reactions these days? Or what does it look like when you have a patient who is having an adverse reaction? And tell me a little bit about how you treat.
This is Chris. We don't see them very often. It's maybe a handful a year. What we typically do is we give them, what we will see is either like heavy salivation, sometimes swelling at the injection site. Sometimes they just break out in hives. It looks like an allergic reaction. They don't always manifest the same way. And how we treat it is we'll give them a shot of diphenhydramine or Benadryl, and then also in some cases we'll also just do a shot of dexamethasone SP and then monitor them. And then now we notate in the chart that they are a vaccine reactor. And then after they've had that instance where they have been a vaccine reactor, what we will do is pre-med them with Benadryl for the next vaccines that they will need. And it's usually just a longer visit with us. We give them the Benadryl injection 15 minutes before we give them the shot, and then monitor them after to make sure they're not having any more reactions. And I would say pretty much all of them do not have a reaction after that first time since we pre-med with Benadryl.
This is Adam. Yeah, pretty much what Chris said. That's a lot of what I see too. A lot of times the vaccine reactions that I'll see are either immediately after or within the first hour or two after giving the vaccine. We'll see similar type signs. Sometimes you'll see facial swelling at the site of injection, or pain, even just pain at the site of injection. Sometimes vomiting. I have had extremely rare occasions where they have come back with like pale mucous membranes or a fever. Again, those are extremely rare, very few and far between of those types of things that I've seen. And most of those, all of those that I've seen come back in with issues have responded very well to the diphenhydramine injection and the dexamethasone injection. Again, just to kind of ramp down that immune response that the vaccine's providing. Again, just like Chris said, they respond well. And then at that point, moving forward, we don't necessarily say, okay, we're not going to vaccinate you now, because again, those vaccines are still very important, but we do want to give that pre-medication beforehand just to try to limit those vaccine reactions. And yeah, if you pre-medicate appropriately and give enough time before you administer the vaccines, the odds of you seeing that response or that reaction reoccurring in the future is very low. If you're appropriately pre-medding. So again, it doesn't exempt them from vaccines at that point. Again, we just need to do a little pre-medication beforehand.
And this is Brandon. I agree. I haven't treated vaccine reactions any differently back when I was giving vaccines and saw the handful that I saw during my relatively short tenure as a GP. And kind of like Adam said, just kind of triaging the client as well and expectations after something like that's happened, because you have some folks that are very understanding. They know it's something that can happen. And then you have some folks that are like, I don't ever want to vaccinate my pet again. And you just have to set expectations appropriately, making sure that you pre-med them for the next time, explaining, that this can happen. And I warn, like back when I was a GP, I would warn folks. I'm like, hey, sometimes dogs have a reaction. Like, this is what we're looking for. We had a pretty standard protocol to hand out like vaccine reaction, like kind of like what to watch for with the discharge papers. That was just like a standard thing to give to new pet owners. So, as long as you're setting expectations and letting clients know like it is a possibility and you have a game plan, then most folks are understanding and are not afraid to give vaccines down the road.
And this is Adam. I just wanted to add one more thing on top of that. again, like we're saying, like these are few and far between. So like I'd say all of us, or at least me and Chris being in GP, given vaccines more frequently. I mean, where I'm at, we're given hundreds of vaccines a day, and we see these reactions, even counting the mild ones, maybe like once a month. Like super rare to see these. Just like Brandon said, you always want to, let the client know that these are a possibility. But again, we're talking maybe one reaction for every, few thousand or 10,000 vaccines given. So extremely rare that we see these, even the mild ones.
And this is Jeff again. And I kind of want to point out two scenarios where I sort of see them now. And I echo everything y'all have said so far from my days in GP. Immunotherapy is considered a vaccine as far as treating allergies, and essentially immunotherapy is taking the mostly pollens, grasses, trees, and molds that are used after allergy testing and work up with either some general practitioners do some allergy testing. Most of it's done with dermatologists, but it's basically sterile water and pollens for the most part. And those are given in extremely small amounts based on allergy testing and a full workup to make sure the case applies or to make sure that case fits with an atopic patient. And as they're given, you can certainly have, I'd say, also an extremely rare amount of patients who will react. And the reactions are, while they are extremely rare, the ones that I might see would be you're itching a little bit more before or right after you're given an injection. And sometimes I will treat with, I'd say the most common thing is an antihistamine for a day or two, or I may have that patient actually get an antihistamine as a 1 to 2 hour pre-medication before the next set of shots, or I may actually adjust the volume that I'm giving or spread out how frequently they're given. And that I'd say it's pretty rare for me to have to eliminate immunotherapy, which is used to help essentially desensitize the body or get the body more used to vaccines so that they experience less scratching and itching and other symptoms occasionally with their allergic disease that I see in derm world. The other one that I wanted to bring up was cutaneous adverse vaccine reactions, which I will see most often. Again, I think this is a very important vaccine, but I've probably seen two that are confirmed via biopsy in my career where they will lose hair in the site of like a rabies vaccine area. So they can actually develop, and I hate the time period, so it's very hard to nail them down, but depending on the literature you read, 4 to 6 months after receiving or let's say within 4 to 6 months is a time period where if you're losing hair, usually on that right rear leg, that could potentially be associated with the rabies vaccine site reaction, causing like an ischemic dermatopathy, aka all of the capillaries there in that area might be experiencing inflammation under the skin, and that can lead to hair loss. And in those cases, usually if no other medications or food have been given, and we can kind of narrow it down. It doesn't have to be as long as I've mentioned, but that's the time period of history I look for. Those are cases where they get usually it's confusing because they have sort of like a non-inflammatory patch of hair. But if you biopsy it, sometimes you can catch a little bit of inflammation. And if you're really lucky, you can actually see a little bit of it's called the adjuvant, which actually comes with the medication that's the true vaccine. They're put in together. Essentially, the adjuvant's job is to help so it's not the vehicle, but its job is to help stimulate the immune system along with the vaccine. And in very, 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 very rare cases, again, I think I've caught 2 in my career via biopsy, you can find that you might have a little patch of hair a little patch of hair loss on the right rear leg in reaction or in relation to a vaccine. And I'm going to go on a limb and say, Adam or Chris, have y'all ever seen that in practice by chance?
Like a little patch of hair loss on the
right rear.
The only thing I've seen is more like a scar tissue buildup.
Mm-hmm.
And the owner's like, oh, it came in for a mass, and we're like, it just got the vaccine the month prior, and it maybe had like a BB-sized thing of tissue, scar tissue, and we monitor it, and it went away within a couple months. So that's the only one that I've seen.
Yeah, same. I've never seen alopecia at the site of injection like that.
Mm-hmm. Yeah. Okay. I would hazard a guess, Brandon.
I saw a dog that I didn't vaccinate myself and had like what looked like could have been like that alopecic like response secondary to vaccination in the past, but I've never like actually seen those types of cases.
And that kind of drives home, I think, more of the point again, is we're talking about really rare things where it's good to catch it, but the long-term effects, there are some medications for the condition I just described, adverse vaccine reaction to the skin or cutaneous adverse vaccine reaction. But again, extremely rare individual cases. I would not stop giving vaccines to my dog because I saw it in a couple of patients. And that in that particular case, that is one where I would have a client conversation and see what makes sense moving forward as far as vaccines for those individual patients, which is always itemized. And a good point to bring up, though, that I hadn't thought of, I think most of us are pretty aware of like vaccines occasionally can cause, I think it's like, gosh, nobody quote me, like 1 in 10,000. It's a very small number that can happen in cats associated with vaccines. So there are isolated cases that can develop a mass. And if you feel like you're noticing that, take your pet to the vet. But again, I wouldn't not give vaccines in worry that could happen because it's just so exceedingly rare. And another question that I had as we kind of get towards the endish here, let's establish, are there any new things with vaccines and that any of you know of? Please tell me. And then what do you all consider your core set of vaccines? And that can be for dog and or cat.
This is Chris. So for core vaccines, I would say definitely rabies, distemper parvo combination, bordetella, and then lepto. I know lepto wasn't considered a core vaccine for the longest time, but now it is considered core, or it's now being labeled as a core vaccine. So those are my core vaccines. I've kind of always considered lepto core. But yeah, those are the ones that I would say we can definitely I know some boarding facilities require flu vaccine. I don't really consider that one a core one unless you're going boarding a lot or doing shows. Lyme would be also more lifestyle. If you're on a tick preventative, then technically you're preventing against Lyme, but I always recommend Lyme vaccine as a backup in case you forgot your tick preventative.
Yeah, as far as dog goes, same as Chris, the DHPP, bordetella, and the rabies, obviously, are the three core. We really push for the lepto. Usually we'll just throw that in because you can get it with the DHPP. Obviously we communicate with the client what they're getting with that, but we try to encourage them to bundle that with the DHPP to do the DHLPP. I don't vaccinate a ton for Lyme. Again, it is kind of lifestyle specific. I probably vaccinate more for flu, just because a lot of the dogs I'm dealing with are more likely going to grooming or boarding or dog parks or places like that where the flu is going to be more prevalent. As far as cats go, as far as core vaccines, we have the FERCP and the rabies vaccines. And then the optional FELV vaccine. Typically, I like to do a combo test to make sure they're negative for FELV before we do administer that vaccine, because otherwise it's kind of pointless to vaccinate for it. So I do encourage them to get that combo test first. And then, plus or minus that FELV, especially if cats are indoor-outdoor or strictly outdoor, do strongly recommend that FELV vaccine.
And this is Brandon. I agree with you guys overall with your general philosophy for core vaccines. And that was mine as well. we can share this in the show notes. I was just double checking. So AHA has canine vaccination guidelines that are available for 2022. And then AHA and the American Association of Feline Practitioners, or AAFP, have like a joint set of guidelines for cats. For the cats specifically, that FERCP vaccine is definitely core. Rabies is core. And then they actually consider FELV core for cats younger than a year. So just like to get that initial immunity. I didn't know that. That's new to me. But like after a year, they say based on lifestyle. So that was interesting to find. And then surprisingly, they don't list Bordetella as a core vaccine, which I was really surprised by. Probably because it's very self-limiting. It's not usually a life-threatening disease, whereas all these other ones like distemper parvo, canine adenovirus, and rabies and lepto are pretty life-threatening diseases. So that was just a little surprising. I didn't realize Bordetella was not considered "quote unquote" core according to the people that make some of the guidelines. But I would consider it core with all of my patients if I was still out in practice, because it is just so rampant. And like Adam talked about earlier, you vaccinate these guys not really just to prevent the disease from happening at all, but to minimize the morbidity associated with the disease if they were to contract it.
Yeah, this is Jeff again, and I have honestly no notes in general. I would just want to point out when Brandon's mentioning AHA, he's talking about the American Animal Hospital Association. So they're a big organization that puts out a lot of really excellent resources and guidelines. And we will also link some information in our show notes regarding a article that they just put out. It was published, they published an update on October 29th of this year. And the original was from June 21st of this year, so 2024, where they mention lepto is now being considered a core in some scenarios. So please take a look at that. And I think as we kind of get towards the actual end, that's our last on-topic question. But as we kind of switch gears back into a general get-to-know-you style question, I wanted to ask y'all, as of the time this is being recorded, we're in late fall. So what is your favorite holiday?
This is Adam. I'm not going to lie. When it comes to the holidays, I'm kind of a Scrooge. I'm not a big holiday guy. I will say that of the holidays, I would say one of my favorites, probably Halloween. I like the spooky season. I like haunted houses. I like all that. I like candy. I have kids now, so it's fun to, help them pick out their costumes and get them dressed up and take them trick-or-treating and stuff. So I would say Halloween.
This is Brandon. I'm not obsessed with Christmas like some people on this podcast may be, but I would say Christmas is probably my favorite. I'm a little biased though, because like another one of our members on the podcast, my birthday is close to Christmas, so I get excited around that time too. But yeah, like it's not just I don't know. I'm not the type of person that wants to put Christmas stuff up before Thanksgiving. After Thanksgiving, it's all Christmas time, and that's great. And Christmas is my favorite because I like giving gifts to other people. It's fun. I enjoy it.
So this is Jeff. I'm going to push back on that. Christmas is the best holiday of the year. After Halloween, like November 1st is Christmas. It is Christmas season right now, and it is my favorite holiday. That is also my birthday is December 2nd, so I'm getting the closest to Christmas. Well, no, Brandon, you beat me. December 6th? Nailed it. Bestie. So for me, Thanksgiving is just first Christmas. Christmas is better because you get to give gifts and receive gifts, and that's one of my favorite things, one of my love languages. So I think it's the best.
After November 31st or 30th.
On November 1st until like maybe mid-January. Chris, what's yours?
I'm kind of in the middle of Adam and Brandon. Definitely not in your camp, JT. I like Halloween, but I'm not a big spooky guy or haunted house guy. I do like spooky stuff. I don't know. I mean, I like Christmas is great too because you got to give gifts to people. I do like doing that. So yeah, I'm kind of indifferent on holidays. They all have their own place. I do like the summer holidays more just because it's summer and we get to do outdoorsy stuff a little bit easier.
Fine.
Or you could go snowboarding on Christmas, like I've done a couple of times. That's a lot of fun.
It's not the best snowboarding in my neck of the woods.
Mm.
We got rooms out here. We got bedrooms.
There is a difference between probably snowboarding with Chris in North Carolina and snowboarding with Brandon, who lives in Colorado. Probably a little itty bitty difference.
All right, Brandon, we'll see you the 26th. All right, we'll fly out there.
Okay, sounds like a plan. I'll be off.
Perfect. Thank you once again for joining us on the Dogtor Bros.
If you would like to support us, please share this episode with others who may be interested in today's topic, and leave us a 5-star review on Apple Podcasts, Spotify, or wherever you listen to your podcasts.
Would you like to influence our next episode? We love hearing your opinions and thoughts. Your comments may be our next topic.
Please leave us suggestions via email at thedoctorbros@gmail.com, DM us at thedoctorbros on Instagram, or leave us comments on our posts. Again, this is Brandon. You can reach me at Dr. Mason IM on Instagram.
And this is Chris, and you can reach me on Instagram at dr.chrishernandez.
And this is Jeff. You can find me on TikTok or Instagram at DermDrJeff, DermDogtorJeff.
And this is Adam. You can reach me on Instagram at DrAdamDVM. That's DrAdamDVM.